Okay, it is 9 o'clock on Thursday, June 18th, 2020, and I want to call the Humboldt County Board of Health regular meeting to order. And we'll start with roll call. Sheriff Allen,
Here.
Commissioner French,
I'm here.
Commissioner Brisden,
Here.
Commissioner Cherry. Not here. Commissioner Bell.
I'm here.
And County Manager Mendiola.
Present.
We are recording and we will go on now with a pledge of allegiance. Please join me in the pledge. I pledge allegiance to the flag of the
United States of America,
Republic for which it stands, one nation, under God, indivisible.
indivisible, liberty and justice for all.
Thank you. We'll go to public comment. Just as a reminder, if you're new and on here today, you'll have to *6 to unmute yourself, and please identify yourself. We'll take any public comment now. Is there any public comment?
If you're the meeting organizer, press star now.
Okay.
Please wait for you are now joining the meeting. This meeting is being recorded and or transcribed.
Yeah. Folks, please, I'll mute everybody here. Something's going on.
Okay.
Oh. Mr. Chair, I'm going to mute everybody and then you'll have to come back in. All of us will.
Okay.
That sounds
Good.
good.
Okay. Is there any public comment? One more time. No public comment. We'll move right along. We'll go to the update. The public health officer, and that's Dr. Stringham. He's not with us today. So, Mr. Mendiola, would you like to give us some information that you got from him?
Yeah, so Dr. Stringham has had a death in the family. His mother passed away. He's in San Diego. I don't think he'd mind me telling you that. So he just wanted to pass on that we haven't had a case in, one case in the last 4 weeks, essentially right now. There is a new positive case yesterday, we believe, but this individual actually contacted it out of state and they returned to Humboldt County. They did not come in contact with anybody here. Immediately they knew they got tested here. And the whole family's quarantined right now. So we don't expect, the whole family's being tested today, I believe. So if they have it, they've all been together for the last 10 days. So we don't expect that to lead to any others. And again, it was not contacted here. So he's very happy about that. His belief is the reason that we haven't seen anything like some of the upticks around the country is primarily due to the fact that people are doing the right thing, and I would say, and I was going to mention later on, that I have been all over town, and while I see a definite relaxation of folks with masks and things like that, one thing that I have noticed is that people are definitely doing the distancing thing. Like even friends of mine who you walk up to, and I'm used to just walking up and shaking their hand or hugging them or whatever, they just kind of stand back. And everybody's doing a really good job of that. And even my own family members. So anyway, I think it's his belief that that's really what's going on here. And he feels really good about the direction we're going. There is, we do get some calls on occasion we actually got, and Nicole did a letter, I think through Facebook, I'm not sure, from an individual who had come into town, stayed at one of the local hotels, and she was very concerned about the fact that while some of them had masks, they had them below their chin, just around their neck, and weren't doing the right thing. So I have reached out and contacted the owner of that facility just to let them know that there was a concern from one of their patrons. But beyond that, I think, like I said, things are very, very good. Dr. Stringham is very happy. He will be back next week. And so one of the things that I want to make sure we talk to on future agendas is about possibly after next week. I'd like to have another meeting next week, and Dr. Wood too, just so he'll be back and he'll be able to give a full update. And then the other thing is that maybe from that point on, go to every other week. Again, assuming things continue at the current pace. So that's his message to everybody, and he wanted to thank especially our citizens of Humboldt County for really stepping up and doing the right things.
All right, thank you. Okay, so we'll move on to Nicole Maher. Would you like to give us an update? Probably took that out of order. Maybe you're not ready.
Yeah, she was there. She just needs to unmute
Can
herself.
you hear me?
There
Yes.
you
Oh, I think that, okay. Yep, I had to unmute myself. Thank you. All right. Well, good morning. And as Dave mentioned, we do have that one more confirmed case. So we are at 79 in the county. It's a 35-year-old traveled out of state, like Dave said. So self-isolating at home, and that family is getting tested. And so we'll wait for that. We do not have any hospitalizations right now, and we are going on several weeks since that's been the case. As of this morning, Humboldt General has completed 975 tests. 20 of those are pending, and of the 20, 4 are actually symptomatic. And so you might be wondering, well, why the other tests? And we've seen some really high pending numbers. Part of that is that the state lab is just having a really difficult time catching up from all of the community-wide testing that's been going on. And so they're about 10 days out on average to process tests. And so some of these tests are people being retested so that they can return to work if they've had an exposure. Some of them are pre-op tests for people who are going into surgery, and perhaps some other reasons, but of those 24 are symptomatic. I also just wanted to briefly mention that the Silver State International Rodeo will be coming in June 28th to July 5th. And it appears that we have a little bit higher registration than we've had in the past, so people are anxious to get out. We have 550 kids who are registered right now. Usually in the past we've had about 400 with family members. Kim Peterson is kind of on the low side, but thinking that we'll have at least 1,000 people in town from that. And so Kim's done a great job working with the state and with Dave and with the Ag 3 board in following the guidance from the state for livestock events. And at this point, they have a protocol in place for conducting a medical survey of each family, having them fill that out and sign that. And then just if a family experiences any kind of symptoms or things, then they'll report that. And they have a lot of great protocols in place for mask wearing, for social distancing, and hand washing stations and sanitizing stations and things like that. And so anyway, it should be a really good event, a fun thing to be able to see our community welcome some guests. As Dave said, I was just speaking with Kim this morning, and we were talking about maybe just sending out a letter to motels and hotels and restaurants and just asking them to put their best foot or maybe their best mask forward, and just reminding them to practice those important things. So having their employees wear masks and socially distance and wash their hands frequently so that we can make a great impression on these guests coming in. As far as our statewide impact this week, I think as we all know, has seen its highest increase in COVID cases yet. And all the state added 379 new cases to the state's tally in one day. That was on Tuesday. 342 of those were in Clark. Now, just to give you an idea, the previous record single day jump was on May 22nd. That was 295 cases. So this one with 379 new cases kind of shook people a little bit. Some of that obviously is, there could be all sorts of factors.
We lost you, Nicole.
Hey, Nicole, my fault. Unmute yourself. I did recognize the number and I muted you.
Can you hear me now?
Yeah.
Yes, ma'am.
You just finished with the 342 in Clark County, and that's where we lost you.
Oh, okay, perfect. And so the previous record single day jump was on May 22nd with 295 new cases. And so just to kind of compare those 379 in one day versus 295, certainly there could be all sorts of reasons for that. Perhaps tests came in right at the right time and things like that. But certainly that is concerning. Washoe also saw its largest single day jump, and so did Elko on that same Tuesday. And as of right now, the state has just over 12,000 confirmed cases and 475 deaths. We've seen cases around us go up just a little bit. As I said earlier this week on Tuesday, Elko reported 10 new cases. And so Elko is currently at 51 cases and 1 death. Humboldt, we are now at 79 with our 4 deaths. Lander, a single jump this week to 23. And Pershing is now at 5, 3 of those from the same family. It appears that Humboldt is no longer, at least according to state statistics, is no longer the leader as far as per capita cases. That dismal honor goes now to Lyon County. But we are just seeing, as Dave mentioned, just a bit of an uptick across the state. I just wanted to conclude with some really interesting data that just came across from the Department of Health and Human Services. And this is interesting. Since the very first cases that Nevada had, what they did was they wanted to see if this latest uptick is a different demographic than what we've seen up until now. And interestingly enough, yes, it is. So since the latter half of May, Nevada's observed, of course, increases to the number of daily new COVID cases being identified throughout the state. And so this deep dive into this data compared those cases identified in June, so this would be over these last June 1st through the 15th, to all confirmed cases before. And just wanted, again, to see if any one group was disproportionately represented. And so as of June 15th, daily new cases are growing at a rate of 2.1%. And for comparison, the growth rate up until now has been 1.4% in the state. During the period from June 5th to June 15th, we've seen this increasing trend, a 10-day trend of increased cases and also increased confirmed hospitalizations in Nevada. And so here's just a couple of quick things that I wanted to mention. Out of those, when we consider kind of race, ethnicity, and age, all of the cases leading up to June 1st, we had about 32% Hispanic or Latino. And after June 1st, we've gone up to 52% of new cases. On the converse, white or non-Hispanic cases have dropped from 36% of total cases now down to 23%. And so these are interesting, and just wondering what's at play here. And age-wise, whereas the cases before June 1st, we didn't see a real strong younger age distribution. After June 1st, those cases have gone up to 32% versus 24% before. And on the flip side, people over the age of 50 have dropped from 37%, of all cases, now down to 21%. So just kind of the findings are that we're seeing more younger people being affected by this virus, and more Hispanic people being affected by this virus. So just some interesting things as we're watching this across the state. A couple of other quick things. Clark County has kind of put a stop to reopening businesses until they see more people wearing masks. And like Dave said, I think people here are still doing a good job with that. In Washoe County, with this kind of lag in the state, just having so many tests to process, Washoe County has stopped all asymptomatic testing for now until they can get the state lab caught up. And just another quick just reminder that that COVID at its very heart spreads. And I just wholeheartedly follow Dr. Stringham and agree with him that people here have done a great job. We've seen some scary numbers in the past, and certainly with the nature of this virus, it can spread. It can spread from other counties, and it can come here, as we've seen with this latest case. And so we'll just continue to gently and kindly remind people to do those right things, and to find ways to insert that into the conversation as we go along. I'm happy to answer any questions that you have.
Yes, Nicole, thank you for your report. I have a question. You said that after, or from 6/5 to 15, that the percentage in the Latino community had jumped to 52% of the new positives. Has there been any conversation statewide with what we found here, that we weren't getting the message out to the families before we started someone into the home that could talk to them and explain it?
And I think you just nailed it, Ken, that some of the articles that I've read, just trying to identify some of those trends and why they're happening, that is one thing that they've identified, is that perhaps that messaging is just coming late, because it would predominantly be in another language. And so, yeah, we might just be seeing a bit of catch up with that.
Thank you. Any other questions for Nicole? No questions? Okay. We'll move on to Captain Sean Wilkin, and the local emergency manager for your report.
Good morning. So emergency management is in a consistent state at this point, where things are settling out in a quantity of cases. Our resource requests have pretty much come to a standstill. I've reached out to other agencies and community partners. Nobody's requesting any additional PPE or equipment like that. We did receive masks from Department of Emergency Management. Those are delivered to us by Civil Air Patrol. So I do want to thank them for the time to bring them up to our community and provide those to us. Those have been distributed to county management as well as City of Winnemucca. So we brought them masks as well as gowns if they need them for community activities as far as their business and stuff with city employees, and some additional hand sanitizer. Justin Luna, the chief from DEM, reached out to me yesterday to ask if we needed more hand sanitizer, and I wanted to ask Dave Mendiola about that. This sounds like it's similar to the conversation we had about the stuff being donated from the mines. So I don't know if we're receiving that and this is additional, but I don't want to make a duplicate resource request and take anything away from other communities in the state that may need that resource. So I do need that part of things sorted out. Otherwise, state is also in a pretty consistent state with where they're at with this management of the incident. When I was talking with Chief Mooney yesterday, we went over a few things, and kind of as a whole, from the EM perspective, we're in good shape. As a county and as a government agency, we're doing the things that we need to do. Things are being managed well. Our community partners are working well with us, and things are going good.
Captain Wilkin, how about the supply of the rapid test kits? Are those getting easier to come by?
So they are, and my understanding is that the hospital is in a position where they can make those requests for purchase or procurement to the state lab directly now. So that has changed a little bit. So I'm no longer facilitating the requests in a rapid test because we got into a good spot with those throughout the nation as well. So if the hospital is able to procure those, when I reached out to Teresa Bell, they didn't have any need for resource requests at that time. So then the hospital needs to make that request or that purchase. One of the things that's changed as things have gone along and resources became available, if we can obtain that resource at our own expense, and if the vendor has it available, we have to take that option prior to making a request to DEM. And if we're denied that option, let's say we're trying to purchase rapid test, masks, those kind of things, we have to provide them with the evidence that that purchase was denied before we can make the resource request now. So and it kind of ties into your question about the rapid kits.
All right, thank you.
You're welcome.
Any questions for Captain Wilkin?
Mr. Chair, Dave Mendiola, just wanted to mention to Captain Wilkin that we were expecting that shipment of hand sanitizer this week. To my knowledge, it has not arrived, but I'll follow up with those folks to find out the status of that. But as soon as we get it on the ground, it'll be stored downstairs in buildings and grounds, and we'll let you know, and then we'll have plenty of it at that point in time.
Okay, and if there was a cross communication between the folks who spoke to you and offered to provide it, because Chief Luna was aware that you had talked with them, if we need to submit the resource request, then we just submit the resource request and we'll get it. So it wasn't an issue of obtaining, it's just making sure we did it the right way.
All right, I'll get back to you.
Yes, sir.
Thank you. Does anyone else have a question of Captain Wilkin? Hearing no questions, we'll move on to the next item. Thank you, Captain. Overview of the state COVID-19 impact. I think probably Nicole just did that, but presentation summarizing the impact of COVID-19 from a statewide perspective, including total number of positive tests, hospitalizations, deaths, and current trends of the virus. Do we have someone else on that's going to give a report on that?
Mr. Chair, no, Dave Mendiola, that is exactly what Nicole did in her piece there. I'm wondering, I would kind of be interested, since we've got Tiffany on the line and she's got audio. I'd love to get an update from her on what's going on with the hospital and where they're at this point.
Well, that's our next agenda item, so we'll move right on to that. And Tiffany, we'll let you give us a report, and if you could comment on the antibody testing and the rapid tests and what's going on at the hospital, we'd appreciate that at this time.
Absolutely. Can you hear me okay?
Yes, we can. Perfect.
Wonderful. Finally, success. So currently at the hospital, as Nicole stated, we do not have any inpatients with COVID testing. I am very happy to report that at our last board meeting, we were approved to purchase they call them robots. They're disinfectant machines, ultraviolet C disinfectant machines. So basically what they do is they blast this ultraviolet light into the room that would kill any germs or viruses such as COVID-19. And, our staff has done an excellent job with cleaning the rooms. We really don't have a problem with hospital infections, but this increases the rate of cleanliness to 99%. And so, we're always pursuing excellence. So we're very happy to be bringing on board this new way to disinfect not just our patient rooms, but it can also be used in the operating rooms and other areas. So, and we're continuing to look at other innovative ways of cleaning and disinfecting our facility. With regard to the antibody testing, there are two types of tests. There is one test that is not very specific, and it only tells you if you have the antibodies or not. It gives you a positive or a negative. We had those tests, and we had to send them back to the state. So we no longer have that type of antibody testing. And our medical director of the lab did not like that test because it's just not specific and the value of that information is limited. Now, what we are in the process of purchasing is a Telica Direct Load, and that is a machine that can do the antibody testing where it tells you exactly how much antibody you have. This is the preferred test because this will give the physician the opportunity to determine, does the patient have immunity? And so this machine would also be a capital request for the hospital. We are waiting for quotes for purchasing the machine as well as leasing the machine and just paying for the reagents. So that should be coming to us this week. Elko currently has this machine and has this test. Dr. Mardini is the medical director there as well. And the cost of the test in Elko is $150. And that's because, you have to charge for the test and the phlebotomy and whatever else is included in that. So at this point in time, we are in the process of getting quotes to purchase. And I will give the board an update as soon as our board of directors decides which way we should go versus leasing or going with that capital purchase. I'm pretty sure our CEO wanted the board to be involved with that decision.
So, Tiffany, so the first test, it's not real specific, just negative or positive. You are not doing those at this time?
No, we were sent a shipment of those tests, but then there was some kind of problem with the test itself. So our medical director, we were instructed to return those test kits. So we don't have those.
Okay.
Yeah.
Any questions for Tiffany?
Mr. Chairman, this is Commissioner French. Tiffany, I was just wondering, in as much as Elko has set the price at $150 per test, do we anticipate HGH and Humboldt County following that lead?
We're suspecting that it might need to be about the same, but we haven't, it really is going to be based upon, I think, what it costs for us to run the test. That's really going to be the determining factor. And, if we go a different way than Elko, I think they purchased their machine. If we decide to go with the lease instead, I don't know if that would change how much we can charge. I really don't have the data to be able to say for sure, but I would imagine that's a factor that we would consider as we're trying to determine what the cost of the test should be.
Thank you for that. One small follow-up question on that.
Sure.
In reading the criteria under the CARES Act, it appears to me that purchase of that equipment and purchase of those tests are likely covered under CARES reimbursement. And if that's the case, if the federal government is going to step up and pay for the cost of those tests and whatnot, do we pass that along to the patients, or how does that work?
Well, you know, with the CARES Act, and when we're giving those federal dollars, there are a lot of stipulations that come along with receiving that federal funding. And so our CFO, Tim Powers, definitely will make the determination of if we can purchase this machine under the CARES Act. But there is a lot of financial tracking and other criteria we have to meet when we're trying to make the purchases with this earmarked money. So we have to make sure that we can comply with whatever is required by the government if we decide to use the CARES Act money to purchase the machine.
Great, I appreciate that. If you could report that to us as you find that stuff out, it'd be good information for us as we take it back to the governor's office. Thank you.
It would be my pleasure. Absolutely. Thank you.
Mr. Chair,
Yes.
Dave Mendiola. Tiffany, today, this afternoon, there's a call with NACO, and it's specifically about the CARES Act and what can be submitted for reimbursement and what cannot. Gina Rackley, our comptroller, has been researching that information that came through along with the money that was sent for Humboldt County and the city of Winnemucca. So if Tim would like to join that call, we can have Gina get that information, the call-in information to you. It might be of interest because I think they're going to have some more details on that.
Yes, I would appreciate if you could send that along. I think that probably would be valuable for him. Thank you.
We'll do it.
Are there any other questions of Tiffany? No other questions for Tiffany with future agenda items.
Mr. Chair, so as I mentioned earlier, so next week, I'd like to continue, have another meeting of the Health Board at Thursday, 9 a.m. And Dr. Stringham will be back for that. He'll have a full update on the antibody testing issue and how we're going to roll that out. And then also, you know, he'll be able to give a complete update. He was looking forward to doing that this week, but of course that didn't work out. And then after that, I'd just like the board to think about going to every other week, assuming that we continue on the same path of, you know, no tests or very few. So anyway, that's what I've got.
Really? We're going to cut some meetings back? Like that.
I know you hate that.
Sure. And let's leave an item on there each week for Tiffany to report as we go forward with possible purchase of equipment and what the hospital's doing on those fronts.
Very good.
Do you have a question, Sheriff?
Yeah, I just wanted to add to what the county manager just said. I do agree that we do need to take a look at if we can cut back on the health board meeting after the next one. I do agree with his assessment on that. The only other thing I did want to add is we did do about 9 or 10 COVID tests in our jail with some inmates, and they all came back negative. So we're happy with that. We're able to, on the procedures that we've established, the protocols we've established in the jail, they're working. And right now, if somebody is brought in, we basically isolate them for 14 days unless we're able to get them tested. And if their test comes back negative, then we're able to put them into the regular population that they're classified for. So just really proud to say that we've been able to keep COVID out of the jail up to this point, and I do say knock on wood, and we hope it continues. The arrests are increasing as the different phases are implemented throughout the state. We are seeing a few more arrests than what we did, say, about 2-3 weeks ago. So I just wanted to update everybody that what's going on here in the Humboldt County Jail. Thank you.
Thank you, Sheriff. Any other future agenda items from anyone?
This is Tammy, the clerk, again, just noting the need to include the minutes for the health board on the next agenda.
Thank you, Tammy.
Thanks, Tammy.
Any other items? Okay, we'll ask for public comment at this time. If you're on and you'd like to comment from the public, unmute yourself. That is *6 on your phone. And we'll take those comments now. Please identify yourself. It looks like the public doesn't want to talk today, so no public comment. We will adjourn this meeting at 9:35 a.m.
Thanks, everybody.
Thank you.